Okay, I just want to say a few more things about DES and what does that stand for? Diethylstilbestrol. And that's where we ended up on last Wednesday. It's hard to say where we are always at the time, but anyway. Okay, so let's do a little more diethylstilbestrol. And I can't remember what number it is. That's thalidomide. Of course, you guys you're gonna read this stuff and pull out biology, right? Pull out the biology and mechanism of action. One thing I don't think I stressed enough on Wednesday is that this is an estrogen-like compound, right? I think in some place it says non-steroidal. Yeah, there it is, synthetic non-steroidal estrogen. But it still has to interact with the receptor. It has to interact with estrogen receptors, okay? So then this is actually, then you could also call it an estrogen agonist, right? You name the parent compound and then the word after it tells its action. So an estrogen agonist is a compound that acts like estrogen, and it's got some ring structures there. It's not like a pure steroid, but I could see how some receptors would interact with this. So it's always a receptor thing. If a hormone has an action, it has to fit into some receptors, okay? And then some tissues might not have any receptors, and then some tissues have a varied amount of receptors depending on the physiological state of the animal. Okay, sometimes estrogen receptors in a tissue might be low, or sometimes they might have a lot more than other times. So it's kind of a dynamic thing. Okay, so then, I think this was the long one. Is this about? Yeah, this is about diethylstilbestrol. I'm never going to ask you anything about, like, is this the chemical structure? I mean, on a test, I wouldn't have like 6 chemical structures and have you pick out diethylstilbestrol. But you should know about the use of the compound, maybe a little bit of history. And I guess here, it was historically widely used to prevent potential miscarriages. Okay. So there was some, reason to use it, but it goes, there's a lot of other things, but I'm not going to ask you fine details. I guess try to pick out the biology, the biggest biology, it reduces cancer, whatever, okay? So this is a long one, but I guess I can't apologize for it because it is pretty good. There's that word squamous again. And of course, neoplasia. Neo always means what? How's the prefix? And plasia means growth. So neoplasia, new growth. Anyway, read that, pull things out. You might not, you might want to know what it does in women versus what it does in men. Okay, but these are pretty good things, and like these tables here, you wouldn't have to read those, right? They're going to have some text that says what the table's about, because this is like separate tumors and the studies and the probabilities, all that stuff there I wouldn't even look at, because they're going to talk about the data in general in the paragraphs. Okay? Subcutaneous implantation, if you're not familiar with that, it's one way to deliver hormones and drugs is you put like testosterone or diethylstilbestrol in a little celastic tube. It's like, think of a tube and you shove the chemical in the lumen of a tube and then you seal both ends. And you can do this, I've made homemade implants. Then you use like a trocar and put them in the subcutaneous, implant. If you do it by yourself, otherwise you buy these growth promotants you can, and you can have an implant gun. Anyway, they're made so then the body tissue fluid gets absorbed into the tube, and then it slowly gets taken out of that tube after a certain time. So it's called an implant. You could do, most of the time you do it subcutaneous. Sometimes then you would want to take them out. So then you can, you put them in and you cut them out, or sometimes you just leave them in and at the time of harvesting. They don't get into the meat supply usually because they're going to be subcutaneous, and when they take the hide off, it's going to come off. Okay, so if you see anything like that, there's all kinds of stuff that are done. Okay, and the tables again, they're going to be summarized in the text, so there's a lot of stuff here that you don't have to read. I wouldn't read any of those tables. But I read definitely absorption, distribution, all that kind of stuff. Okay, genetic and related effects. There's a nice little term. Okay, all kinds of stuff. Somebody's agreeing with me over here. Yes, you're right. Yes. Okay, yeah. Okay, history of, okay. What? You don't agree with that? What? Yes. Okay.
What? What's going on?
Yeah, okay. Okay, here's what I want to do now. Come over here. I know on Friday night I sent everybody an email about what was found in pet food. What was it? Did you guys get that email? What was it?
Phenobarbital.
Not phenobarbital, but you should write down phenobarbital and keep it separate from this other thing. Pentobarbital. Write both those words down because we're going to talk about that now. It's not on our reading list right now, but I'm going to put it there by the time we come back Wednesday because that's going to be on the test. So pheno, P-H-E-N-O, barbital. And then we're going to contrast that with pento, P-E-N-T-O, barbital. The email I sent out was about pentobarbital found in some pet foods. I think it was mostly dog food. Aaron, did you get that?
No, sorry. We were talking about the dog food.
Oh, did you guys get the email though?
Oh, the email, yes.
Yeah, okay, that's what it's, okay. So the first thing you start with, we're going to talk about actions of those two drugs. How do you get pentobarbital into dog food?
Euthanize livestock, usually.
Okay, euthanize livestock. Do you know what? Livestock are usually not euthanized with pentobarbital. It takes too much. What are livestock usually euthanized with? If you had like a 1,600-pound cow. Well, I guess, yeah, a captive bolt if you were at harvesting it, like on the farm though. Anybody know? Saturated solutions of potassium chloride. It stops the heart. Quit pulling the hair off my leg. Yeah. Okay, back to the original question. How do you get pentobarbital into dog food? Somebody, anybody. You make the dog food from dead dogs and cats. Is this a a new thing here? Most dogs and cats are euthanized with pentobarbital. Some drug that has pentobarbital in it. Then those animals are taken to like ABDL. Has anybody been in the cooler behind the necropsy floor? How many have been in that cooler behind the necropsy floor? Yeah. I've been back there where the animals were this high. I had to like walk over dead things. Well, anyway, there's these rendering trucks that go around. And I see it on campus every once in a while. It doesn't say rendering. It's a white truck. You ever see a white truck and it goes down to the vet school and comes back? That's full of dead animals, okay? Then they're rendered, and then the pet food companies buy the rendered products and put it into dog food and cat food. So how do you get pentobarbital into dog food, that recall? Someplace in the production of the dog food, they've used rendered products. Okay? Maybe some horses are euthanized with pentobarbital. Anybody, big horse people here, how do you euthanize horses? What's the current? Anybody? You know, I'm not talking about like at harvest time. I used to go to places where they harvested horses. Now it's still outlawed, right, in the United States? Yeah. Okay, so we need to talk about pentobarbital. It's used to euthanize dogs and cats, especially. The carcasses, a lot of them get put into rendered products, meat and bone meal. And then pet food companies use that product to make dog food. That's really the only way you can get pentobarbital into dog food. It doesn't occur anyplace.
How is that legal?
How is it legal? If you read that email on the that I sent out, it says that it might be the USDA. There was this little line that kind of irked me a little bit. Small amounts of pentobarbital in dog food is considered harmless.
I mean, but like as for cannibalism.
Oh well, that's another cannibalism. That's a whole nother topic, right? Oh yeah, I mean it's amazing. Anyway, there's no other way to get pentobarbital in dog food unless you use the carcasses of dogs and cats. Okay? There's no other way. It doesn't like occur in nature. It's not found in grain. It's not made by mold. It's got to be that way. Yes.
Isn't that kind of the same thing or similar to mad cow disease? How they all got started?
Well, yeah, because the mad cow disease, yeah, that's a good point. The BSE, how that got started was they were using ruminant products to feed ruminants. Yes, and then that's how they spread BSE. Good point. So it's kind of similar in that sense. You're feeding animals products that come from their kind.
How do they determine what's like harmless?
Yeah, well that's the whole
There's
thing.
different sizes of
Yeah.
dogs.
How do you determine what's harmless? And here's the other thing is, I want to make sure you guys know the difference between acute and chronic. Okay? So no, I think they're referring, when they say harmless, I think they're saying, well, acutely it won't cause illness or it won't cause death in small amounts. And you know, right, in toxicology, dilution is the solution, right? So small amounts of poison aren't going to do anything acutely. And the definition of acute is rapid onset, short duration. So it might not have any acute effects, low levels, but again, how do you know, they're not monitoring batches for this stuff. Chronic is prolonged onset, long duration. See how you contrast that? So anyway, I think they're talking about acute, but the thing is, I think that's still disgusting to have pentobarbital in your dog food. I don't care if they say it's harmless. I was kind of insulted that the pet food company said, well, in low amounts, it's harmless. Okay, you're having that drug. I know where it's coming from. You can only get it from euthanized dogs and cats. There's no other way to put it into the food supply. And here's the other thing is, when you inject these drugs into an animal that you're euthanizing, there's going to be a high concentration in the body tissues. Because it's basically an overdose of a hormone, right, or a drug. And then the animal dies. And then it doesn't metabolize that drug. It sits there. So the half-life of the drug is immaterial. Because the animal's dead. The half-life relies on metabolism. So you overdose this animal, dog or cat, based on body weight. The bottle, I used to have bottles of this stuff when I was working with animals a lot. It says right on there, so many mils per kilogram body weight. But the thing is, then the animal's saturated with this, and there's no metabolism going on. So now you've got this drug in this carcass that sits maybe in a cooler for days, then it's rendered, and then it's put back into the dog and cat food.
What would that look like on an ingredients list? Like if I want to buy a dog food that had no rendered products.
Yes. Okay. The good question is, how can you like safely avoid this stuff? And that's a long answer, so maybe let me reserve that, and maybe I can find a nice article that talks about that. I have had people come in front of classes and talk and had done a little background about this thing about what does it mean to have meat and bone meal or beef flavored. There's little guidelines, but it's really kind of, I think, I can't remember if I made a videotape of that, but it's really interesting. There's like, it's got to be a little percent. To be called beef flavor, I think it had to be like 2% beef. And then if you say dinner, it means something else. There's all these little things that they do. But anyway, the point, I mean, that's a good question, right? But it's ridiculous. But so you don't know, what low amount, but I was like insulted. Oh yeah, low amount, it's not going to hurt anybody. We're going to do the recall anyway. It should never happen. And you don't routinely check for pentobarbital in any of your ingredients, right? Like aflatoxin, if you use corn, then you always check for aflatoxin. When you use animal byproducts, or whatever they are called, rendered, you don't usually check for pentobarbital, but it's going to be there, right? So let me do a Google search on pentobarbital, and I just want to talk about the actions of pentobarbital, and then we'll contrast that with phenobarbital. But you should know the two things. Okay, so good old Google. Okay, Pento, didn't spell that right. See, pentobarbital in dog food. We're just going to go pentobarbital images. Okay, so now, uh, 2,500 milligrams per 50 mils there, it looks like, right? And whenever you see something that says like pentobarbital sodium, a lot of these things can't be isolated purely. So it's like there's a sodium on the molecule, but that's just the way it goes. So I think does it say 50 milligrams per mil on the bottom there? I think it does. Okay. So pentobarbital sodium. And I'm just going to actually just look for some images here that have, oops, sorry. Okay. Nembutal is another name it goes by. And maybe what I should do. Okay, so it's a Schedule 3 drug. There's different schedules, and you have to have like a DEA number. When I used to work with animals, I had a DEA number, and I could order different class of drugs. Of course, yeah. Both parties, okay. Anyway, that's not really, I'm going to search actions of pentobarbital. Let's do that. That's what I want. Here we go. Okay, here we go. So, see, it's it can be an anesthetic. And it basically depresses the nervous system. Okay. This is as fruitful as I thought it was going to be. It's going to depress the nervous system. That's about all I got out of these things here. Okay. Let's see what else we got. Okay. Duration of action. Okay. Now notice this is good because it's got the phenobarbital too. So pentobarbital it's a relatively short-acting anesthetic. 20 minutes, it looks like. Now, that's not the half-life, but it gives you some idea, IV. And then phenobarbital, which we'll talk a little bit here, it tends to be a sedative and
we'll talk about that in just a little bit here. Okay. So let me see. Prescence. Okay. Pentobarbital. Okay. Okay. Short acting. Pental. Okay. Short acting. Okay. Ultra short. There it is, right there. Pentobarbital. Okay. Phenobarbital. So they are related. And they're basically sedatives, okay? Pressing the action of the nervous system. Okay. Mechanisms of action. So it's basically on the nervous system, the endpoint is. And I'm just looking for something that's extra special here, but I haven't found anything. Okay. Okay. So obviously pentobarbital and phenobarbital are related. Depression of the central nervous system, sedation, coma, death if you get too much of it. Okay. So, one other thing here. Let's see, I'm misspelling that, but okay, there's the recall stuff. Okay. Okay, there's animal euthanasia. Advantages of sodium pentobarbital: speed, minimum discomfort, smooth drug action, inexpensive. Disadvantages: you have to have somebody that does an IV injection. But if you're desperate, where else could you inject this and probably induce euthanasia? I mean, sometimes it's hard to get a hold of a vein, and this is not a. The second way is like when you're super desperate. Anybody know?
The heart.
The heart. Well, that's not a bad answer. You know, it sounds cruel, but the intercardiac injection, that might be the third place. What's another place? Well, jugular is IV. What if you can't find an IV? If you can't find a vein to do it? IP. But it's definitely slower absorbed. What's IP mean? Intraperitoneal injection, IP. Okay. Oh, there. Look at this. Persists in the carcass. Look at that. Disadvantages. Sodium pentobarbital. I mean, that's. They don't come out and say that they're using dead dogs and cats in their dog food, but that's how you do. I mean, that's all it is, right there. Persists in the carcass. Yeah. So this whole thing about rendering, that we'll try to work more on that. Okay. So then. Let me spell out that the other way to do it. Intraperitoneal. There it is, right there. Okay. Remember, I'm not recommending this at all. I'm just saying I've seen it done where somebody couldn't do an IV injection, and you inject the drug into the peritoneal cavity through the abdominal wall. I think that's what they're showing there. Let's see. Yeah. I guess that's what they're showing. I don't see. There it is right there. The site, looks like a sheep though. The site of intraperitoneal injection of glucose solution. Okay. So that's a way to give the animal a drug, or in this case, glucose. If you can't hit a vein, find a vein. Okay, so then let's do phenobarbital. And what's the most common thing they use phenobarbital for? What's that? Antiseizure, exactly. Phenobarbital, often given to animals to prevent seizures. I used to have a dog, Blackie, that one Thanksgiving day, she had a seizure, and never before that, once an hour for 24 hours. And of course, you know, it's a holiday. At that time, there weren't really any emergency vet clinics open. And convulsing, and when she got up, she couldn't get up very well, and she was blind. It was affected her brain so much that she was blind, urinated, defecated during the seizures, and put her on phenobarbital for years, every day. And then when she got older, I said, because I know it's bad for the liver, I said, Blackie, we're going to wean you off phenobarbital and see what happens. And weaned her off, and she lived another 4 or 5 years without a seizure. Interesting. Anybody have a dog with seizure that they're giving phenobarbital?
I don't get phenobarbital, but actually my dog's first seizure was also on Thanksgiving.
Interesting. Maybe it's the smell of turkey. No, I don't know. Isn't that interesting? Yeah. Now, what do you give the dog then?
We were told as long as they're really fine, we didn't have to give anything.
Oh yeah. What did they tell you? What?
As long as the seizures are pretty far in between,
Yeah.
you don't want to get anything because they can completely.
Is there? Okay. Oh yeah. Yeah. I think there isn't a recommendation if it's once a month or less, then you don't do anything.
That's what we were told.
Yeah, I think that's the general recommendation. Because, you know, you can have a dog that has a seizure and never before and never after. So how often is your dog having seizures?
He's only had 3 since Thanksgiving, so he's like right after one.
He's close, yeah. So it'll be interesting. Okay. Anybody else experience with phenobarbital, often given for seizures? I don't know, do they... I'm not all that familiar with cats. Do cats have seizures like the dogs do? And do you give phenobarbital? Anybody know?
Kind of. When it's a vet clinic, like they try to not give that first, but if it's really like excessive in convulsion and foaming or salivating, then that's
Okay. I guess I just have not seen that many cats have seizures.
Is it pretty expensive?
Oh, cheap. Phenobarbital?
yeah.
Cheap. Really cheap. Yeah. Yeah. Super, super cheap. Okay, anyway, phenobarbital. Okay. I think we've talked enough about that. Let's go on and... Okay, so here's what I'm going to do before I forget. See right above here, this is that line. Above that was exam 1. Below it is exam 2. I'm going to put the pentobarbital stuff right in here. It's not a teratogen, by the way. So I looked up a list. Remember that long Purdue list where there was like 1,000 things? Pentobarbital is not on that list, so I'm pretty confident to say that it's not a teratogen. So, but I'm going to like put it up there above antifreeze. So I know it's going to be on this exam, and by Wednesday there'll be some links there about pentobarbital, and I guess for completing this, I'll put a link or two on phenobarbital, so you don't get those two mixed up. Okay, let me go down to the rest of the teratogens and see what we got here. Okay, this is that ethanol thing. We talked about that. I think that's my graduate student there that did the study. I think I also sent you a link this weekend about the Florida shooting and how somebody might think that that person has fetal alcohol syndrome or fetal alcohol spectrum. It's definitely a terrible thing to have. Let's look at our last teratogen. Okay, the Zika thing. I put this on here, I think, a couple years ago because this virus then is a teratogen, isn't it? It affects the development of the fetus. Because babies that are born, look at this normal, it almost looks like the goat appears poisoned, doesn't it? Like stretching and... Hi, guys. Hi, guys. And that's normal goat behavior too, the jumping like that? Yeah, very normal.